Hello, my name is MrozewskiL, and today I will be presenting to you the project entitled Impact of Northern Residents on Sepsis Outcomes. The authors for this project include myself, Paul Michael, Asim Kumar, and TC Tai. With regards to disclosures of affiliations and financial support, I have no relationships with for-profit or not-for-profit organizations. This project has received funding from the NHRC FA Research and Development Fund, as well as NHRC in the form of a CGSM. So we're now going to delve into the project itself, and in order to understand what we're looking at, we must first look at what is sepsis, and we also must define northern communities for our context. So first and foremost, sepsis is a life-threatening condition that we're going to see characterized by a dysregulated host response to infection. And in septic conditions, patients are going to have high levels of inflammation, and upon progression to either severe sepsis or septic shock, we may see organ failure and potentially death if that treatment is unsuccessful. Sepsis is also highly prevalent, with approximately 1 in 6 hospitalizations in Ontario involving sepsis. And rural and northern communities are actually at an increased risk for sepsis, partially due to increased infection risk and limited access to care. In addition, rurality in general has been shown to be associated with an increased sepsis-caused hospital deaths. And then, so for context of this poster, northern communities are going to be defined in accordance with the definition given by the Ontario Ministry of Health in Rural and Northern Healthcare Framework from 2011. And as part of this framework, there are 133 First Nation communities, of which 30 are considered remote. Northern and Indigenous communities in Ontario do face numerous inequities regarding their access to and quality of healthcare. Some of the factors that lead to these inequities are distance to care, a chronic shortage of doctors, and inadequate healthcare facilities and resources in Indigenous communities. Many Northern and Indigenous communities are also serviced by telehealth stations or nursing stations that often face staff shortages or limited access to resources such as medication supplies that are necessary for the treatment of disease. The research question that we examined for this project was whether northern residents impacts the prevalence, risk, and outcomes of sepsis. In order to address our research question, we performed a scoping review of the extant literature, and this literature search employed both Google Scholar as well as PubMed. The included papers were selected using a set of inclusion criteria, and the information was extracted and synthesized into a narrative review. We identified numerous risk factors that might increase the risk and/or severity of sepsis cases in Northern Ontario's rural, remote, and First Nation communities, and these included high levels of cigarette or tobacco smoking, unsafe drinking water, poor nutrition/food insecurity, limited access to healthcare services, as well as generally an older demographic. We also considered the existence of comorbidities, including kidney disease, obesity, diabetes, as well as other chronic diseases. We also identified a time to treatment problem, which stems from the guidelines of early administration within 3 hours of admission to emergency room or 1 hour of admission to ICU, with the time it takes to commute or to reach emergency departments in some of these Northern Ontario communities, which in some cases can exceed 60 minutes. We also identified something that was quite interesting, which was that many organizations did not have guidelines for the rapid diagnosis of sepsis, which poses another important problem to address. We can employ numerous strategies to address some of these issues, including education, both of practitioners and the general public. We can also address the time to treatment issue, potentially through the use of newer technologies such as telehealth to help improve access for patients in more remote areas. And we can also look at addressing some of the issues surrounding opioid use disorder and implementing harm reduction strategies, such as safe injection sites and syringe exchange programs, expanding the scope and use of those to help lower infection rates and help minimize the risk of developing sepsis. In conclusion, sepsis is a significant healthcare concern for northern communities, and future studies could take a more clinical care-based approach to addressing shortcomings in sepsis care, thereby improving patient safety and outcomes. I would like to thank my collaborators on this project, NHRC University, Laurentian University, as well as NHRC.